Good morning. My name is Maria, and I have glaucoma. As a trained psychologist, I did not realize the importance of those three words, glaucoma, have glaucoma. My journey has been long and very complicated, and I feel very fortunate to be here today to explain some of the things that I've had to endure and experience. As I said, the journey started with me having some difficulties in my right eye, feeling as if I had something in my eye. At that time, I went to see my ophthalmologist, who did a puff test and said to me, I think you may have either syphilis or a brain tumor, neither of which was a really good explanation. So because of that, I did have a spinal tap that almost left me paralyzed. And finally, they decided that, in fact, I did not have syphilis, nor did I have a brain tumor, but that rather I had a disease that 30-year-old women who were pregnant tended to have. I was neither 30, nor was I pregnant. And fortunately, it was not the time of the iPhone or Google, because it would have been difficult for me to really research that. So I just disregarded it and went on. It wasn't until a couple of years later when a friend of mine, an optometrist, said, Maria, come to the office. You need some new glasses. So I went in, and he took my pressure, which was in excess of 70. And he said to me, oh my gosh, do you know you have glaucoma? And I'm like, what is that? So quickly, he referred me to, quote unquote, a glaucoma specialist. I went over, and the man essentially looked at me and said, thank you, and said, you need to have surgery. And I said, what does this mean? I don't know what I have. So he gave me a book which primarily dealt with the anatomy of the eye and said, come back after lunch, we'll do surgery. So I took the book and again wondered, what is this disease that I have that I needed to have surgery so quickly? Not knowing, and unlike me, I went back and did have surgery in my right eye. He then dismissed me, sent me home with no practical precautions. I had a persistent headache that was very similar to a sinus headache, so I went ahead and took some decongestants. It did not go away. I went back, and the man was just irate with me that I chose to take a decongestant. Again, not knowing why that was wrong, I tried to ask him what was the problem, and he just continued to yell at me and saying how I did not know what I was doing. And he was correct. I didn't know what I was doing. I didn't know what I had. So I went back to my optometrist friend and said, you know what? I'd rather go blind than go back to that man. He has not explained a thing to me, but he continues to yell at me if I'm an idiot. Of course, I was referred to someone else who fortunately took the time to explain to me what was going on. Even at that time, even with her being so understanding, I still did not know what I had. So by that time, the internet had become much more popular, and I went online and found a very useful website where patients would gather and discuss their different type of glaucoma that they had. And finally came to the conclusion that, yes, I probably had close-angle glaucoma. So I went back and said to my physician, is this what I have? And in fact, yes, that's what I have, and learned that I need to be really cautious with some of the medications that I take, and that, in fact, even in terms of dilation, I have to be very careful. Then it became, the pressures were not able to be controlled. So I decided to go for a second opinion, at which time a physician assistant decided that he was going to dilate my eyes. And I said, gee, you know, I have close-angle glaucoma. I don't think you need to do that. And he insisted that, no, that was his job, and he knew what he was doing. And I said, I'm having a real problem with that. At which point the physician walked in, and I said, I don't think I'm supposed to have a dilation. And he said, oh, you're right. He said, however, if you go into closure, this is a perfect place for you to be. So needless to say, I didn't go back to that guy either. Nor did I really continue to really research it further. As time went by, there was a need for me to have my cataracts removed in my right eye, which is my worst eye. And I went to an institution, a highly regarded institution in the United States, to see what it would entail to have my cataract removed. And at that time, that physician stated, he looked at my eye and he said, I don't think I can do this surgery. He said it would take a year away from my life, and it would be like you having a child through your nostril. At that time, I truly realized the severity of what was going on. And I made it my goal to pursue finding people who were experienced in dealing with this type of glaucoma, as well as people who were willing to discuss with me the procedures and what it entailed and the intervention that were most effective. I did have my cataract out, which was fine, no problem. I did have radioplasty, over 400 to 1,500 burns or holes put in my eye. That still did not lower my pressure. I, unfortunately, had absolutely no symptoms from, as we all know, from glaucoma. But so then they decided that perhaps a trabeculectomy would be the way to go. But as usual, my body does not respond to many things. I have very atypical reactions, and that was not successful. After that, it was decided that the vitreous sac would be removed from my eye. And in fact, that was very successful, and my pressures have been lowered and have been, and my fields have been pretty stable, which is wonderful. So what is the moral of the story? What is it that we as patients are looking for? I know that for some physicians it is very difficult to have patients coming in asking a million questions. However, for me, and I think a majority of people, education is really the key. And the ability to be able to discuss and understand what may be going on can be very helpful. As I think back and I realize some of the interaction I've had with some of these physicians, I realized that my compliance with pharmaceutical intervention was really quite poor. And I knew it was poor, and I had no intention of changing it. Therefore, making whomever was treating me really work twice as hard, and making me very unhappy that nothing was changing. So if there's a message that I really would like to impart onto people is, as patients, we will never know the information that you as physicians know. However, we can also give you a great deal of insight on what's going on with our own body, which in turn can make you better doctors and us better patients. Because without our compliance, without our willingness to work towards a common goal, neither one of us can be at our best game and do the best job we can.
9 minutes left.
Oh, I have 9 minutes, so I can talk. The whole process for me was one which now in retrospect I can look and say, oh my gosh, I really was playing with fire. I mean, I could be blind today. And it wasn't because I am not a willing participant in my own care, but because of the lack of empathy that I receive from doctors, or their willingness to share their knowledge base, that it made it very, very difficult for me to really help them in treating me. Today, when I go in and see my doctors, there's much more of a communication between the two of us. And although at times it may sound as if I'm driving them crazy, they can also appreciate the fact that my willingness to pursue their recommendation is there, and therefore they're going to be much more successful than they would have been otherwise. Thank you. Questions? No questions? Okay, thank you.
If you want to stay up, we can see if there's any questions or comments.
Yeah.
So Maria, what are you, looking back, besides obviously what we could have done better as a physician community, were there other resources that you would have hoped to have had that maybe you could have accessed?
I think the resource that was most helpful for me was it's the Wills Clinic has a website in the United States. And as I said, they have, it's a community of patients with all types of eye disease. And one of the things that they were doing, when I haven't been on it for quite a while, simply because I feel much more comfortable with my own illness, but they also had physicians that once a week were online to answer questions that patients may have. They had topics on a weekly basis, and those patients would queue in to ask the question, and the physician would give the answers too. And that was extremely helpful. One of the things that I've realized is, and this is why I started my speech by saying I have glaucoma, is that people in general have an incredible fear, rightfully so I think, incredible fear of the disease. And when you say to someone, I have glaucoma, the general reaction is one of fear and dismay, like you have some sort of communicable disease. And I think that the ability to share with people and say, yes, this is a disease that we need to be aware of, but we also need to work towards in terms of improving, it is very beneficial. And I think that as a patient, that has been one of the things that I always find so incredible, that even educated people can look at you like, oh my gosh, you're going to die kind of thing. Which is, I think, for people who may not have a good sense of what is going on with them, can be pretty damaging.
Did anyone have any comments or questions? We've got a couple of microphones. Yes, please, go ahead.
Yes, well, thank you for your words. Besides the patient's net that you told us, is there any other advice that you can give us for any other country? I live in Chile, for example, for some things that we can do to better get the information for our patients. The web is something very interesting, but groups of information, I don't know.
Yeah, I think for me, not knowing what glaucoma meant, and I'm a fairly educated human being, and have somebody just hand me a book and say, okay, this is the eye. That's all it was. It was just the anatomy of the eye. It's not beneficial. It's demeaning. It is certainly not instructive. So one of the things that I think would be really very helpful, if you have patients who are willing to connect with new patients who have been just recently diagnosed with glaucoma, it's very, very helpful, because then you're able to speak with someone who can say, yes, this is what I've experienced. These are some of the questions you may have. And especially since there's so many different kinds of glaucoma, my experience certainly will not be the same as yours, but you may want to ask these kinds of questions.
Thank you very much.
Support groups are also very good, by the way. Okay.
So I think what the key messages that come through from what Maria Gorby has said, and thank you so much for saying it so clearly, is that the key to human dignity is an empathetic relationship with open communication, which requires explanation, because as you've said, one of the greatest obstacles that has to be overcome for patients is fear. Mm-hmm. And fear is greatly amplified by unknown. So ignorance amplifies fear. Absolutely. And it's only through communication and education that we actually have an opportunity to diminish that fear and to engage in a positive therapeutic alliance which benefits both the patient and the outcomes that they experience and what the services that the physician is able to offer. And as you've said, information for you would have been the key, as well as an empathetic approach to providing that. And that's where patient associations and patient support groups like the online one from Wills that you've spoken about become so very important. And the World Glaucoma Association, in conjunction with the World Glaucoma Patient Association, has encouraged the development of patient support groups and patient support associations around the world. And over 60 such organisations have come into being in countries that had no such support to provide exactly that kind of forum to reinforce the messages that the physician often doesn't have time to give in detail and to repeat, which is what's necessary.